If you have certain bacterial infections, you might be able to treat it with an antibiotic. One type of antibiotic is called Augmentin. Here's what you need to know if you've been prescribed this medication. Bacteria usually duplicates in the body, and this overgrowth creates an infection. Bacteria want to survive, and they have a few tricks to do that. In fact, some bacteria have developed a resistance to one of the most common antibiotics, amoxicillin. Augmentin is a combination of two antibiotics, amoxicillin and clavulanate. This duo together is able to kill bacteria that tend to have resistance to amoxicillin by itself. Here's how it works. The amoxicillin prevents bacteria from making the protective covering they need to survive, which causes them to die off. But some bacteria are able to make special enzymes that cause the amoxicillin to not work well, which can lead to antibiotic resistance. Clavulanate blocks some of these enzymes, and this makes the amoxicillin more effective. Your doctor may prescribe Augmentin for infections in the inner ear, sinuses, lower respiratory tract, skin, soft tissue, or urinary tract. Augmentin usually comes as a pill you swallow whole, but you can also get it in liquid or chewable form, which may be helpful for children. You can take it with or without food, but taking it with a meal may help reduce side effects, such as upset stomach. One of the most important things to remember when taking any antibiotic is to finish all the doses your doctor prescribes as directed. You'll likely start to feel better after a couple days, but you need to continue the medication to ensure that the infection won't return. Both your prescriber and your pharmacist can answer your questions about side effects, which may include diarrhea, nausea, or skin rashes. These are pretty uncommon and generally mild. Don't be afraid to ask your pharmacist or provider about affordability. These days, there are many options for low-cost ways to get your medication.